I mean, the UMA combines all the physicians in the state, and so it just has a louder voice, I think, working together as a whole. We're a bigger group when we all work together, and there are so many issues that affect, our patients as a whole, that affect physicians as a whole, and so I think that it's a louder voice, and UMA also just has a long-standing reputation in the state, and I think that the legislature hears us when we speak, when the UMA speaks to the state and the legislator. So I think the UMA has additional value in being many voices together. Definitely the financial services is my number one. I wouldn't know how to navigate finding a good financial representative who I wasn't concerned about potential ulterior motives. And I feel like it's so nice to have the financial services here where I know they are working in my best interest, and it just makes it easy because I know how to find that group and how to get their help whenever I need it. Second thing would be just the connection to other physicians in the state. I've always enjoyed being part of the women's physician section because I feel like I can make those connections to other women physicians, and I've found a lot of different friends and colleagues in those meetings as well. The opiate training, which is required for our licenses, it was really nice to find through the Utah Medical Association website, and any CME offerings that have come through section meetings or other UMA offerings have always been nice to add to my CME profile. I started when I was a resident, and so that must have been I think it was my first year as a resident, and so thinking about how old I am. So I think I would say 14 years I've been part of the UMA, and I think I've gone to the majority of the House of Delegates in that time. I've always been someone really interested in public health. I got a master's in public health, and patient advocacy has always been my number one priority, and I feel like the UMA is the one place where my voice can really make a difference in deciding what kind of services we can provide to our patients, how we can represent our patients, because that's one thing that matters to me a lot. And so I've really enjoyed being part of the House of Delegates and moving policy forward that has meaning to me and to my patients.